Every year, over 350,000 people in the U.S. die from sudden cardiac arrest, and most of them never saw it coming. 1/3 of these tragedies happen while people are sleeping. No chest clutching, no final words, just a peaceful-looking sleep that becomes permanent. Take Martha, a 74-year-old from Missouri. She often woke up at night with a racing heart, restless legs, and drenched in sweat. Her doctor said it's probably just aging. But one night she woke up gasping for air and collapsed before she could call for help. Thankfully, she survived. That's when doctors discovered she had suffered a silent heart attack. Are you ignoring the quiet signals your body is trying to send? In a country like the U.S., where 1 in 4 adults over 65 has some form of heart disease, the silence of the body can be more deadly than any sharp chest pain. Waiting for something obvious to happen could be waiting too long. This video will reveal 7 nighttime danger signs, subtle but critical heart attack symptoms and stroke warning signs that seniors often experience without realizing. More importantly, you'll learn how to recognize them, how to respond, and how to stop a disaster before it starts. Watch closely, because this time it may not just be a video, it may be the knowledge that saves your life or someone you love.
Warning sign number 1. Waking up gasping for air. Your heart's silent SOS. You wake up in the dead of night, your lungs burning, chest tight, gasping as if you were drowning, but there's no water, just silence. Maybe you tell yourself it was a bad dream, anxiety, or a stuffy room. But what if it wasn't? This frightening sensation is more than a restless night. It's a red flag. According to the American Heart Association, one of the clearest warning signs of congestive heart failure, CHF, is paroxysmal nocturnal dyspnea, a medical term for waking up gasping for air. This occurs when the heart can't efficiently pump blood, causing fluid to back up into the lungs while lying flat. It's like a slow, invisible flood that chokes your breath from the inside. Here's the scarier part. CHF affects about 6.2 million adults in the U.S., and it's one of the leading causes of hospitalization for people over 65. What's worse, many mistake this nightly struggle for simple aging. They adapt, sleep sitting up, add more pillows, or avoid talking about it altogether. But let me be clear, this is not normal aging. It's your heart whispering, sometimes screaming, for help. And while it sounds overwhelming, the solution doesn't have to be. Start simple. Try sleeping with your upper body slightly elevated. Monitor your evening blood pressure, a key move for anyone aiming to prevent stroke and heart disease. And if this symptom recurs, speak to your doctor about a cardiac evaluation or sleep study. Small changes, when made early, can shift the trajectory of your health. Because here's the truth no one tells us enough as we age. You haven't lived this long just to survive the night. You deserve to rest without fear, to breathe with peace. And recognizing this one sign could be your first step back to safety. So when your body wakes you up gasping, don't roll over. Listen, then act.
Warning sign number 2. Night sweats without a reason. Your nervous system in distress. You wake up drenched, your pajamas soaked, your sheets clammy. You reach for the fan, then the thermostat, blaming the heat or perhaps a nightmare. But deep down, something doesn't feel right. And you're not alone. For seniors, especially women, night sweats are often dismissed as just hormones or part of aging. But according to a study published by the American Heart Association, frequent night sweats, especially when unrelated to menopause or fever, can signal silent ischemia, a condition where the heart doesn't get enough oxygen without the classic chest pain.
The study found that adults experiencing regular night sweats were 3 times more likely to suffer from a heart-related incident within 5 years, AHA 2020. Think about that for a moment. Sweating in your sleep could be your body's emergency alarm triggered by an overstimulated sympathetic nervous system, one that's working overtime to keep your heart functioning despite narrowed arteries or weakened cardiac output. But here's something many don't realize. Your heart and nervous system are in constant dialogue even while you sleep, and when the balance tips, your body might speak through sweat. Now, before you panic, let's be clear. Occasional night sweats are common. What we're watching for are changes. Are they happening more often? Are you soaking through clothes or sheets in a cool room? Do you feel shaky, nauseous, or anxious when it happens? If yes, don't stay silent. Bring it up to your doctor, clearly and specifically. And here's a practical tip. Keep a nighttime log. Record time, temperature, how you felt. Patterns tell stories the body struggles to say out loud. Remember, this isn't about fear. It's about awareness. It's your chance to intercept a silent message before it becomes a life-altering event. Your heart doesn't need to shout. Sometimes it just needs you to notice the sweat and choose not to ignore it. Warning sign number 3, dull arm or jaw pain at night, the misplaced alarm of a struggling heart. It's 2 a.m. You stir awake with a strange ache in your left arm, maybe a dull pressure in your jaw. You rub it off, shift positions, and tell yourself, I must have slept wrong. But what if your body's not confused, just misinterpreted? Contrary to popular belief, not all heart attacks begin with chest pain. In fact, according to the Centers for Disease Control and Prevention, the CDC, about 1 in 5 heart attacks is silent, meaning the damage is real, but the signs are subtle or show up in unexpected places. CDC 2023. Here's why. The nerves that signal distress from your heart often share pathways with those in your left arm and jaw. When your heart is under pressure, like from blocked arteries or oxygen deprivation, it may send signals that feel like a toothache, a muscle cramp, or nerve pain, especially at night when you're resting. For men, heart attack symptoms often manifest in the left arm, a warning sign that tends to repeat in waves. For women, the discomfort can show up as jaw tightness, neck aches, or an odd pressure rather than sharp pain. These female stroke symptoms are often overlooked even by physicians, which is one reason why women over 65 are more likely to die from heart attacks than men. American Heart Association 2022. The story of Frank, 71, echoes this. He rubbed his jaw with menthol cream for weeks, convinced it was arthritis. It wasn't. He was ignoring his heart's cry for help. He survived a massive heart attack, but now he says, if I only knew sooner, I wouldn't have waited. So, how do you know if your ache is something more? It's deep rather than sharp, like a pressure or heaviness. It comes and goes, not staying constant. It eases when sitting up, but returns when lying down. There's numbness or tingling on one side without an obvious cause. If that sounds familiar, don't chalk it up to age. Write it down. Talk to your doctor. Ask for a stress test or cardiac enzyme check. You've learned to live with discomfort, but not all pain is meant to be endured. Some are meant to be understood. And sometimes the pain you ignore isn't just pain. It's a chance to act before it's too late. Warning sign number 4. Restless legs at night. When your heart speaks through your limbs. You lie in bed, desperate for sleep, but your legs won't let you. They twitch, crawl, or pulse like ants under your skin. You shift, rub, walk a few steps, anything for relief. Sound familiar? This isn't just a sleep quirk.
It could be restless leg syndrome, RLS. And for many seniors, it's more than an annoyance. It's a warning. A study in the Journal of the American College of Cardiology revealed that individuals with RLS were twice as likely to develop cardiovascular disease over a 4-year period. JACC 2017. The culprit? Poor circulation and oxygen deprivation, often linked to early-stage heart failure or stroke risk. When you're lying flat, gravity no longer helps blood flow. If your heart's struggling to circulate properly, your legs may be the first to complain. Don't ignore them. Try this tonight. Massage your calves gently before bed. Use a wearable pulse oximeter to track overnight oxygen levels. Elevate your legs slightly to aid blood return. What feels like a restless limb might be your heart asking for help in its own quiet way. From jaw tension to tingling legs, your body has a language. The more fluent you become, the better you protect what matters most, your life.
Warning sign number 5. Blurred or sudden vision loss at night. Your brain's flashing warning light. It's 3 a.m. You wake to use the bathroom and something feels off. One eye sees clearly, the other seems cloudy. Maybe you notice a patch of vision missing, like someone erased part of your world. You blink, rub, and chalk it up to grogginess. But what if it's something far more urgent? This could be a sign of a mini-stroke, a transient ischemic attack, a TIA, where blood flow to part of the brain is briefly blocked. For women, especially over 60, vision disturbances like this are often overlooked, but they're among the most common signs of a mini-stroke in a woman. According to a study by Yale University, 40% of stroke survivors reported nighttime vision changes, such as blurred sight, flashes, or partial blindness in the 48 hours leading up to their stroke. Yale Stroke Center 2021. That's nearly half, and yet most didn't act on the warning. So what can you do? Start a vision journal. Every morning, cover one eye and look at a clock or a familiar object. Note, is it clear, distorted, missing parts? If anything feels wrong, even if it goes away, don't wait. Go to the ER. Temporary symptoms are still serious. Your eyes don't just help you see the world. Sometimes they help you see what's happening inside your brain before it's too late. From the feet to the eyes, every corner of your body is worth listening to. The next sign might be the one that saves your brain, your independence, or your life. Warning sign number 6. Waking up exhausted. The hidden cost of a heart in trouble. You've slept a full night, but you wake up feeling like you ran a marathon. Even brushing your teeth leaves you winded. You wonder, is this just aging? But deep inside, it doesn't feel normal. And you're right, it isn't. Persistent morning fatigue, especially when paired with shortness of breath or heavy limbs, can be an early symptom of heart failure or even a silent heart attack. According to the National Heart, Lung, and Blood Institute, fatigue is one of the most underreported but common early signs of cardiovascular dysfunction. NHLBI 2022. When your heart struggles to pump enough oxygen-rich blood during sleep, every cell wakes up starved. That mystery tiredness is your body waving a quiet white flag. Often confused with anemia, poor sleep, or just getting older, this kind of fatigue usually worsens gradually, making it easy to overlook. So what can you do? Measure your resting heart rate as soon as you wake up, then again after a gentle 5-minute walk. If your heart races disproportionately, or you feel out of breath, that's a signal worth checking. Also, keep an eye on daily patterns. If the morning tiredness worsens or comes with swelling, dizziness, or foggy thinking, don't ignore it.
Warning sign number 7. Loud snoring and paused breathing, the invisible threat while you sleep. You might laugh it off. I snore like a bear. But what if your snoring isn't just loud, it's dangerous? Sleep apnea, a condition where breathing repeatedly stops during sleep, affects up to 70% of seniors who snore loudly, and many don't even know it. These pauses in breath reduce oxygen to the brain and heart, increasing the risk of high blood pressure and stroke dramatically. According to the American Academy of Sleep Medicine, untreated sleep apnea doubles your stroke risk, AASM 2021. For many, the first clue isn't waking up tired, it's their partner noticing the choking, gasping, or long silent gaps during the night. If someone has ever told you you stopped breathing, that's not just a quirky sleep habit, it's a medical red flag. Here's the hopeful news. Home sleep tests are now widely available, and many Medicare plans cover them in full. You can get diagnosed without stepping into a clinic and potentially add years to your life with a treatment as simple as a CPAP device. Action step 1. Ask your doctor about a sleep study, especially if you have morning headaches, daytime fatigue, or high blood pressure. 2. If you sleep alone, use a smartphone app to record your sleep sounds. Because your snoring may be more than a nighttime nuisance, it may be your body crying out for help. And the sooner you listen, the sooner you can breathe easier, not just at night, but for the rest of your life.
Let's be clear. Preventing heart attacks and strokes isn't just about luck or good genes. It's about making small, powerful choices every day, especially after the age of 60. One of the most transformative steps is embracing the right kind of nutrition. The DASH diet, developed by the National Heart, Lung, and Blood Institute, has been clinically proven to lower blood pressure significantly within just weeks. Combined with the Mediterranean diet, which emphasizes whole grains, olive oil, leafy greens, fish, and legumes, you can reduce your risk of heart disease by up to 40%, according to research from Harvard. For seniors living with or at risk of congestive heart failure, reducing sodium, increasing potassium through food sources like bananas, sweet potatoes, and beans, and staying hydrated within doctor-recommended limits are essential actions. Supplementation also matters. Studies from Mayo Clinic highlight that omega-3 fatty acids help reduce the chance of sudden cardiac death. Magnesium and potassium work together to stabilize heart rhythm, while CoQ10 supports heart muscle function, particularly for those on statins. Lifestyle changes are equally impactful. Going to bed and waking at the same time each day can help regulate your body's blood pressure rhythms. Avoiding meals after 7 p.m. gives your cardiovascular system time to recover. Practicing 5 minutes of slow, deep breathing before bed lowers nighttime cortisol levels, a hidden but potent risk factor for high blood pressure and stroke. Track your progress, especially your evening blood pressure readings. If numbers consistently rise above 130/80, that's not aging, it's a call to take control. Health is not about perfection, it's about attention. It's about listening to the signals your body gives, honoring them with care, and making the next moment better than the last. When the world is silent and the night settles in, your body often speaks the loudest. The restless legs, the morning fatigue, that moment of gasping for air. These are not random nuisances. They are signs, quiet, persistent, and sometimes urgent, of what could be a looming heart attack or stroke. And for too long, many have brushed them aside as just another part of getting older. But here's the truth. These symptoms are your body's early warnings. They are the signals that something deeper is shifting. The heart rarely shouts, it whispers. And those whispers are precious. They are your second chance. You don't need to be a doctor to notice when something feels off. You just need to pay attention, trust your instincts, and take action. Every moment you choose to listen, to ask questions, to change even one habit, that is you protecting your future, not just for yourself, but for the people who love you and depend on you. So tonight, as you lay your head down, remember this. Your heart is not your enemy, it's your partner. It doesn't need to fight to be heard. It only needs you to listen.
Finally, please note that the information in this video is for informational and inspirational purposes. For medical advice tailored to your individual health, especially if you have underlying conditions or are on medication, please always consult your doctor or healthcare professional.